Thank you, and I appreciate you all inviting me here today to speak. This is something that's near and dear to my heart because being an RN and having a master's in community health and living through the derecho, as many of you all did, that you know how important this really is. So thank you for having me. I'd like to call your attention. There's some handouts in the middle of your table. I think there's a collared one, and there should be enough. I hope there's enough for each one of you to have one on your table. The other one I'm going to talk about later in my presentation. It says Cert Skills, and that's from the HOSA, Future Health Professionals organization that I work with. And so I'll be talking about that a little later in the presentation.
Are there extras anywhere?
I don't know.
Sure.
Are there any extra handouts?
You can have blue.
Or did you give them all out? Okay, they're all out.
There's one more.
And I'll tell you something else is that I will send this to Gina to put on the website so that if you don't have something you'd like, you would be able to access it there. Well, my name is Cyndy Sundstrom. I live in Fayette County, but I work at the Department of Education here in Charleston, and I am one of 2 health science education coordinators in the state. I tell you that because our main goal through career technical education is to provide a future pipeline of healthcare professionals for West Virginia. And being in community health and volunteers, as you are, you know how important that is as our population ages, and we continue to work through some of the issues we have in rural West Virginia. This afternoon or this morning, it is still morning, I'm going to be talking a little bit about Teen Cert, what we have built into the West Virginia Health Science Education curriculum for certification, and trying to increase involvement of Teen Cert. And I'm going to try to keep my presentation short, although I could talk about this a long time, because who you really want to hear from are the students. And we have students here from Monroe County with Mr. Scott Womack, and so that's the important part of the presentation to me. Of course, the Teen Cert initiative comes from National Homeland Security. And why should we use teens? Why training teens is important? Schools are part of the country's critical infrastructure. We know that. I mean, most communities have a school. I know that the speaker that was right before us talked about how their school closed. And I know throughout West Virginia we've had school closures, and there's fights about that all the time because it's such an integral part of our communities. But the important part of why training teens or using teenagers in CERT is because with training, students can prepare for and respond to emergencies. And students carry their information to their families, which is also a big part of what we try to do in health science education. I'm trying to do 2 things at once, and so we'll see how good I can be at this.
I can hit that button.
Oh, okay, great. That'd be fun. Thank you so much. The West Virginia Department of Education Career Technical Education Division has a component of health science education. And our instructors, most of them are nurses, some of them are EMTs, some of them are med lab techs, so they come from a healthcare background. And you will see therapeutic services is one of our concentrations, one of our pathways that students can identify that how they want to go into healthcare and what certifications they want to get. We offer several different certifications, but in order to get to the certification process, which is under Clinical Specialty 1 and Clinical Specialty 2, they have to do 2 foundations of two foundation courses, Foundations of Health Science and Advanced Principles of Health Science. Integrated into this curriculum is CPR first aid certification, as well as bloodborne pathogens and disease prevention certifications. Gosh, I'm drawing a blank here, but there are several other different certifications built into the curriculum at that level. most of our students are juniors and seniors, but we have some sophomores that take these courses. And so you will see, we try to focus on the junior and senior level because when these kids go out to clinicals or when they actually go out into the community, they have a little bit better maturity. We have exploratory courses in junior high school for them. Industry credentials, we offer a variety, but the one that you're going to hear about today is Teen Cert, and it's one of the 13 industry credentials that we offer. Okay. HOSA, which is the other handout, the thick handout that you have on your page. HOSA is a pipeline of future healthcare professionals. HOSA is actually the organization, our career technical student organization that we work through with our health science education students. One of the things that they can compete in HOSA is CERT. And they actually have to, they get a scenario, they have to take an exam. If they score a certain percentage on that exam, then they actually get a scenario. And the scenario could say, there's been a derecho in your community and the power is out, there's several trees down, and so you are actually assisting in treating life-threatening conditions, you're assisting with triage, you may have to do some head-to-toe assessments, and you find someone in a house that is not safe, and so you have to actually do a lift and carry procedure, or you may have to splint a closed fracture. You find someone with a fracture and you have to splint it. And they actually have to perform these tasks while judges are looking on. Now, they don't know what task they're going to get. They just get a scenario. And so when they walk in, the judge hands them the scenario. They have to read it, and then we already have the scene set up. It may be in a classroom, or it may, but we play pretend. And so we have the scene set up, and then they go in and do what they have to do based upon what the scenario is. So we actually have them practice their skills through this, which we think is a very important component of the training. And HOSA, it's on different levels. We have them at our local school level, where they will have a local competition. We have then the best of the best comes to state, and we have our state competition at Marshall University, and we actually have folks from that county come in and judge our CERT events and our emergency preparedness events, and make recommendations about who wins, and then those folks go on to nationals. And at nationals, there's over 9,000 students that they compete in. I will tell you, and I'm very proud of this, Greenbrier County Medical Reserve competes in Medical Reserve Corps, and Greenbrier County has brought home the national gold medal now for I think 2 or 3 years in a row. 2 years in a row. I think that's wonderful. It says something about the community involvement, the students, and everybody helping them get to where they need. The thing about the training when you're using our high school students is that you already have your students selected. These students are in the school system. They have to maintain an 80% in each one of their courses in order to move on. That tells you that they have good grades. They have to show up for school, because if they don't, they can't go to clinical, and they can't get their certifications. So that tells you that these students are dedicated, and they see their future role in healthcare as a healthcare provider in some manner. So that makes the choice easy for us as far as trying to use CERT, trying to get this out into the communities, and to get our students involved. One thing that you do have problems when you're using teens is that you have to make sure that you keep them active and interested, and that's where HOSA comes in with their competitions, having t-shirts with their names. And I see the folks from Monroe County here, these 2 young men. I didn't know they were going to be here. I knew that the other folks were going to be here. Or you guys are from Wirt County. Those guys are from Monroe Monroe. So, and one's a junior and one is a 7th grader. And you can see their t-shirts. And it means something to the kids, you know, if you have something like that to wear to school sometimes and show it off, it does a lot to build that. They have a vision, they think, that's pretty cool, you know, they want to know more about it. So that's pretty neat. All right, one of the things that I wanted to show you, this is a map of all of our health science education programs throughout the state, and it's everywhere that you see a little prescription or pharmacy thing, just because we use the other symbols for our other programs. And you can see the counties that are highlighted in blue have a teen cert program somewhere in the counties. Now, the ones that are in sort of yellowish green, they are talking about developing one, and that would be Boone and Wood County. And Work County. Actually, the gentleman from Work County came to me and talked to me, and I'd still like to try to work on getting something in the school system, because I was just talking to that young man over there, and he said, hey, we've had a change of guard, we've had a new administrator and a new principal, and so maybe it's time to talk to them again. Wood County, we actually have our health science education instructor there. The Career Tech Center is now a trained cert trainer. So she's going to be implementing it, I feel pretty sure, or pretty soon. We have one in Pleasance County we have an EMT course there, an EMT course, and the instructor there actually offers a cert training. But as you can see, there's lots of other counties that we would like to have them in. So if there's anything that I can do to help, I apologize. I seem to misplace my business cards, but I'll try to get my contact information out to Gina, and she knows how to get in touch with me. But if there's anything I can do to talk to administration or to talk with teachers or whatever to try to get folks involved, I will be glad to do it, because I truly believe in this. And Deb Catron is the other coordinator of health science education, and there's my email and my phone number if you'd like to get in touch with me. Now, having said that, I'd like to introduce Mr. Scott Womack, and he's bringing the important part, the students, to your attention. Thank you.
Good morning, ladies and gentlemen. I'm Cadet Lieutenant Colonel Taylor Gwinn with the Junior ROTC. I'm their battalion commander. Today with me I have Lieutenant Colonel Scott Womack, Cadet Major Joseph Garcia, our Operations and Executive Officer, and Cadet Captain Nathan Wilson, our Information Officer. And Colonel Womack will briefly discuss our JRTC mission.
Okay, good morning, everybody. Still morning, I think, and we have the unlucky position of right before lunch. I've told my students that no one has rotten vegetables or standardized tests with them, so I think it'll all be fine. I'm going to briefly introduce what Junior ROTC is and what it is not, and then I'm going to turn it over to students until the very end, and I'll talk about some challenges that can come along with the program. Junior ROTC's mission is to motivate young people to be better citizens, period. We are not here to recruit people into the military. Whether students choose to join the military or not is completely up to them. There's no service obligation or anything like that. Our job is, in partnership between the Department of the Army and Monroe County Schools, is to motivate them to be better citizens. And we do that with a mixture of academic classroom instruction in all sorts of topics, study skills, civics, history, current events debates, written weekly assignments, but also some hands-on training in things like land navigation, physical training, drill and ceremonies, all that sort of thing that kind of keeps them active, keeps them moving. Among the hands-on training that we do is the Cert Training, which is something that we have embedded within the Junior ROTC curriculum as part of a citizenship exercise. We do a good bit of community service, and obviously CERT is probably our premier version or our premier thing that we do that benefits the local community. And then lastly, obviously, as they're wearing uniforms and I'm wearing a uniform, she will refer to, or all of them will refer to military positions and titles. We do use a military structure and a military type of education and training as part of the program, believing that for some students, not all, but for some, the structure, the type of organization, the chain of command theory, span of control is actually a useful thing for them to take into their adult lives. So without further ado, I'm going to pass it off to Cadet Gwinn.
We want you guys to know what makes us different from different CERT programs with our organization, equipment, training, activities, and challenges. And to follow behind me will be Nathan Wilson, starting out with organization.
One of the main differences of our program to what may be different than other programs across the state is our military style, which was mentioned before. We obey the military style chain of command, which basically says there is a leader at every level. We don't have a mass confusion. We have one head leader and then 4 or 5 people under them. Our teams, of which those people will organize, are pre-organized. We know who is in our team right now beforehand if a disaster would occur. Those teams are each assigned certain duties that they'll have. We have certain teams that might be primarily of just females who are just like medical programs who could help with like first aid. We don't want those people doing the heavy lifting of or moving certain things for other professionals. So we let those people handle the first aid while maybe a primarily male group or some females even helping out, because we don't want any confusion there. Okay. Our advantages are our structure. We have a firm disciplinary system since we're through the military. We're very flexible, as I mentioned before, certain people having certain jobs, and using military span of control, which says that one person can effectively control groups of 5 or less people, because once you hit that 5 mark, it gets a little hectic, so we try to keep it at under 5 for mass affectionary programs. Next up, our different equipment. One major thing that pops out to me with our equipment and separates us from everyone else is our equipment storage. All of our equipment is stored at one spot instead of like keeping like each individual person keeping their bag with him at all times. We keep them at one certain rally point, if you will, so that each budget comes into play majorly, so that money saying that damaging or losing the different equipment, it's less that we have to pay straight up. One other thing we have are trauma kits, which are larger versions of basically first aid kits. We have different compasses, which if you've ever been to Monroe County, you'll need one where we are. We have great rain gear to keep us dry. There's still some wet spots, and we're in the process of getting military grade stretchers to help out for better usage in the work field. And now I will be followed by Cadet Major Joseph Garcia to talk to you about different trainings.
All right. So, how is our program different in terms of training? With the fire department, every time we practice fire safety and precautions, the Linside Volunteer Fire Department comes to the school and assists us in the training. Instead of teaching CERT the weekends or at night, we conduct our CERT training with the JROTC students once a week as a regular class. One of our CERT programs offers additional training, such as when conducting our first aid training, we have West Virginia Army National Guard combat medics come in voluntarily to train our students. Also, when funds are available, we try to get the students CPR certified if possible. Every week on Fridays, we conduct military physical training to ensure that our CERT members are fit for duty. And finally, every semester we conduct land navigation training with the students. This is useful to us because of our rural area. Following are some activities that might be different from other CERT units. Are some non-disaster related activities, such as adopting 2 miles of US 219, which we recently conducted a litter cleanup on. Smoke alarm installation. One of our alarms we installed last year actually saved the lives of a family right after we installed the fire alarm, about a week after. We have participated in the Governor's Day to Serve, having a school cleanup day where we assisted janitors, planted flowers, and cleaned windows. We have taken part in community events also. We have provided assistance at the annual senior holiday dinner, children's Christmas party, and this year we plan to help set up holiday decorations in the town of Union. This all will be followed by Lieutenant Colonel Womack with challenges of the program.
Okay, so I don't want to burden students with challenges. Challenges always go up the chain, as you know, never down. So the challenges are mine to fix. They're systemic and geographical in nature, so the latter won't get fixed. They just are what they are. One is transportation. I'm forbidden to transport students in personally owned vehicles. I have to use a county car, state car, Army car, somebody's car. And my junior RTC program does not have a vehicle. So at present, if a disaster were to occur, it's up to the students' parents to get them to the school where we can get organized and get our gear, and then to get us dispersed to wherever we're needed. Okay, either using their own transportation or something internal. So that's kind of a glaring weakness. Monroe County's population density isn't. Okay, we're very dispersed, which begs the question: why do we keep our gear centralized and not scattered around the county? If you've worked with teams before, you would probably want to centralize the gear. Nothing, no offense, guys. But also, we don't want teams just randomly helping, because they really do want to help. They really want to be a part of the community, really want to help out, but having them help without trained adult supervision is a liability problem. Perhaps not legally, but at least morally for me. So that's why we keep things centralized. Everyone has to come to the school where we can assign some adult supervision to go with them when they're out helping. Communications, derecho was a big event and exposed probably one of our greatest weaknesses. I was out of town. I am the team CERT point of contact and was unable to do anything because I was out of town with my phone roster with me. So we're going to work on that and have some assistant adults, and that way we can engage the teen CERTs during the summer. Which also does bring up another issue, is this is a high turnover program. We train CERTs annually, but they're students, so they move through the school year by year by year. So in effect, every year we have a new group of 50 to 80 students to deal with, which is good, new energy, new blood, but it's also a challenge in terms of communications. And in the summertime, if you've ever tried to get a hold of a teenager in the summertime, okay, I can't even find my children, let alone my students. So that can be a challenge when school is out of session. Practice drills, this is something that it's on me. We just haven't done a good job at this at the school. We do one at the end of the CERT training. It would be nice to just do a pop-up in the spring. Just with the principal, have her lay some students out in the gym and say, go. So maybe we'll work on something like that. And then I always have to put funding up just because after 30 years in the Army, you always end your briefing with a plea for money. So funding's an issue. CPR training, a vehicle, the more money you throw at me, the more I'll spend. So I'm a good government employee in that respect. But that's always an issue. And there's just some things we'd like to do. And with all the competition for fundraisers, it can be a little dicey sometimes. I'm going to turn it back over to Cadet Gwinn.
Okay. Well, this is what made us different with our organization, equipment, training, activities, and challenges. Now, if y'all have any questions, we would be more than happy to answer them. Thank you.
Yes, sir.
As far as your practice drills, can you interact with your regular, your CERT team in the county to work on that? Is that something that?
The perfect solution would be to have something at the school where transportation for my teen certs is not an issue during the school year, where I have 50 to 80 of them. So yes, it gets difficult if we try to do a program on exercise away. Then school bus would cost money, which goes back to funding, and there's just some issues with things like that sometimes. But yes, ideally, I think Kelly and I have been working on it. Next time we do one, getting the teams going with it. So yes. Yes, ma'am.
Do you involve your fire, local hospital, other resources with your drill?
Definitely the Linside Volunteer Fire Department and West Virginia Army National Guard. We have good connections with them because my fellow instructor retired from them, and his son's a combat medic, so he's useful in West Virginia family. And one of my former students just became one. So those two organizations very consistently. Now that we have a resource officer at the school, I could probably get the sheriff involved too. We don't have a hospital in Monroe County. Health center would probably pitch in for something if asked.
As far as graduation credits, because we know the state of West Virginia is always increasing the credits that you're required to have for graduation, how does the CERT program and the time that you have at school affect your regular classes?
It don't.
It doesn't?
It's embedded into the curriculum. It's
It
part of
is.
the curriculum.
Okay.
Yeah, one of the bright spots about the junior RTC curriculum is it's pretty flexible with what myself and Master Sergeant Wiley put in it, as long as it's civics or citizenship related. CERT actually is so interesting to JRTC that at the Department of the Army level, they have put it in as an pre-approved elective course within junior RTC. So I don't even have to ask permission from the Army to do it. It's already in my curriculum. I just choose to do it or not. So I chose to do it once a year. Yes, sir.
Taking the uniform off for a second and just looking at yourself as certs, when you put on your cert gear and things of that nature, how do your classmates interact with you? How do they view you? What's your perception of how they view you? Are they interested in the program? Do they think what you do is valuable?
Well, they're used to seeing us as a leader or a role model, so they typically follow us. We still use the chain of command even still.
Even out of uniform.
Talk about say something, Nathan.
I want to, but I don't know how to.
Just spit it out.
Just keep it PG-13 and it's all good.
Yeah.
Got a question in the back.